Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I am your host, Dr. Kishore Volodi, and I am really excited to have two guests again today on this podcast, but this time talking about a topic that me, as a pediatrician, I don't know very much about. And I'm so excited to have Dr. Brian Chicoine and Hannah Graham on this podcast with us today to discuss this topic of aging and some things that we can see in adults with Down syndrome that we may not be fully familiar with if we are not working with that population directly. Now, for me, with my brother getting closer and closer to 50, I am personally interested in a lot of the answers to this question, but I'm very, very glad that a listener had sent these questions in for us to answer today. So before we get too far into the podcast, why don't we go ahead and start? Hannah, why don't you go ahead and introduce yourself, who you are, what you do, and why you love working with this population?
Sure. Well, thanks for having me today. My name is Hannah Graham. I'm a family medicine physician, and I work at the Advocate Aurora Adult Down Syndrome Center in Park Ridge, Illinois. So I get to see patients who are adolescents, age 12 and older, and adults with Down syndrome. And that's my exclusive practice. So I really love what I get to do at work. And I'm also a mom, and I'm the mom to a young child with Down syndrome. So I kind of get to wear both hats and get to live in this Down syndrome community in a couple of different capacities. So I'm excited to be here today.
Oh my gosh, that's so great. Dr. Graham, thank you so much for joining us today. And Dr. Chicoine, anyone who has worked with or had questions about adults with Down syndrome, your name will always come up. But why don't you introduce yourself to our listeners, who you are, what you do, and maybe even just a little bit about the practice at Park Ridge that so many have heard about.
Sure. Thanks so much, Dr. Volodi. So first, I'm going to sound a little bit like a talk show groupie. I'm a longtime listener to the podcast. So in fact, I have a half-hour drive home. So that's about perfect for most of your podcasts. So
that's great.
So I listened to one on the way in this morning on Down syndrome, DSAIA.
Yes.
Yes, which was excellent. Anyway, so I'm Brian Chicoine. I'm the medical director of the clinic that where Hannah and I work together. And I co-founded the clinic in 1992 with Dr. McGuire, our former social worker. And we started the clinic when the National Association for Down Syndrome, which is our local parent group, asked the hospital to start a clinic. They were finding their kids were getting good care as kids, but not the same quality of care as adults. So we started 2 mornings a month, and it just sort of went nuts.
Yes.
And we've seen over 6,000 people. So it just keeps growing.
That's amazing. And I think it's pretty clear that it's most likely the largest adult Down syndrome clinic probably in the world. And I think that's a huge testament, and what a service that you all have provided to so many families over the years. So before I get into the details of the question that was asked in the email, I wanted to just kind of get just a general overview of adults with Down syndrome and what we're seeing in this population. For so long, there's been this kind of misconception in society that there are children with Down syndrome that always remain children. And we kind of forget that there's a whole population of adults out there, my brother included. And so what are we seeing now in terms of with adults? What's like our life expectancy that we're seeing? Let's start with that. How long are people with Down syndrome typically living these days?
So, that's a great question. So I always like to start with when my great uncle Leo, who had Down syndrome, although they didn't call it that at the time, was born in 1907. His life expectancy was about 9. And then when I graduated from medical school in 1984, the life expectancy was only about 28. And now it's about 60. So it's been an amazing time during my career that the life expectancy has increased so dramatically.
And why is that? Like, what could account for that? I know Dr. Bulova, who I work with here in Pittsburgh, has said if the general population grew at the same rate of increase in life expectancy, we'd be living until 300. So, like, what's the reason why it's changed so much?
Yeah, I think certainly we'll hand it to you, the pediatric folks, as the real driver in this. That about 50% of people with Down syndrome are born with congenital heart disease. And really up until the 70s, maybe early 80s, that was not surgically correctable. and certainly not available to people with kids with Down syndrome, unfortunately, even when it became available. And so really that ability to surgically correct the structural heart defects that people with Down syndrome are born with has made a huge difference.
Yeah.
I think moving out of large institution settings has made a big impact. And then I think certainly the ability to treat and prevent infections has also made a huge impact. I think, it's probably a little harder to measure, but better healthcare in general, better opportunities in education, recreation, employment, I think certainly have extended the life, but certainly also made that life much more enjoyable as well. So
yeah, and I appreciate all the work for people who have come, even before us, perhaps, that had to really put down the effort to make sure that people with Down syndrome were receiving just even the basics of medical care that we would take for granted now. Were not just, I don't know, even just 30, 40 years ago was not an expectation. And I think that's a sad commentary on society and medical care in general, but so wonderful to see that impact in people with Down syndrome now. One thing that I've noticed in folks with Down syndrome, my brother, his friends especially too, as they get to a certain point in their age, and it seems almost like aging becomes accelerated. It's almost like they reach a certain age and then all of a sudden it's like hair started graying or falling out, or started getting tired quicker and things like that. Is there a phenomenon like that you see in general in adults, that almost like an early aging that might happen?
Yeah, there are data that do show that folks with Down syndrome have this early aging. This isn't as scientific as those articles, but having watched thousands of people with Down syndrome get older over 32 years or whatever, oftentimes it looks like people with Down syndrome before the age of 35 often actually look a little younger than their chronological age, and then they begin to get out in their mid 30s, and that process seems to change, and their aging seems to change, and they seem to actually then seem to be older than their chronological age in many ways. And so we begin to think of people as they get out in their 40s and 50s and 60s. In a sense, this is just a rough guide, but being 5, 10, 15, even 20 years older than that you might think of them as from a chronological age. Now that's not scientific, but I think it's a helpful rule of thumb.
Yeah, and if we're seeing them seemingly aging that much quicker in those decades of life, are there medical issues that seem to come up earlier than you would expect? One that we've talked about on the podcast before, but feel free to address, would be something like Alzheimer's, dementia, things like that. Do we see those things happening earlier then, as they age apparently earlier too?
Yeah, there are a number of conditions that are not only more common, but seem to also occur at a younger age. So things like osteoarthritis, cataracts, hearing impairment, and then unfortunately the big one is Alzheimer's disease.
Yeah. Okay. Now, one thing that we say a lot on the pediatric side is that we seem to see a lot less of these kind of conditions that would keep our internal medicine colleagues usually pretty busy in their practices. Things like high blood pressure, strokes from clots that flow up from their legs. We seem to see less solid organ tumors, things like that. Is that something that you all see in your clinical practice too, that they seem to have less of those types of issues?
Yeah, solid tumors, atherosclerosis. We see very little very few heart attacks in our practice. High blood pressure, hypertension is I think we maybe had 5 over 31 years with 6,000 people. So it's very uncommon. So yes, there clearly are things that are less common. I think that that really has a real implication for healthcare in general. Someone presents with chest pain in our practice, much less likely to be a heart attack than it is reflux, heartburn, for example, which is more common. But also has real implications as we go forward looking at developing screening guidelines. Should we be screening for breast cancer, colon cancer, heart disease in the same way that we would in someone else? And those answers aren't out, generally yet, but I do have my opinions. Well, I won't share my opinions, but those will be included in the next round of guidelines that are.
I was going to say, when you and your colleagues were putting together the adult healthcare guidelines, which for our listeners, if you're wondering what that is, you can find them in. They were released in 2020 in the Journal of American Medical Association. But they're guidelines essentially that were the first of their kind in terms of directing the care, evidence-based direction of care for adults with Down syndrome. And I think, Brian, you would agree that one of the things that you all discovered is that we just need a lot more evidence, a lot more really clear directions research-wise that can help direct the next set of guidelines. Am I right?
Absolutely.
Yeah.
Unfortunately, with each guideline, would be nice to have additional information.
Yes.
But we had to work with what we had, but would have been nice.
Yeah. And I think that's the first step, right? Is that people recognize that while we in pediatrics will complain about how, boy, I wish there was more research for pediatric care of Down syndrome. It's even more of an issue on the adult side, I think, in terms of the lack of true evidence. And hopefully that can change in the coming years. I do want to take a little bit of time today, if we could, to talk about the listener question, which was on menopause in general. And again, this is something that I don't really think too much about as a pediatrician, of course, but even as the sibling of an adult male with Down syndrome, I really haven't thought much about it. And so it was a question I didn't know how to answer. So Dr. Graham, I know this is an area that you definitely have an interest in. Tell us a little bit about menopause in Down syndrome. Like, what kind of age? Are there any unique concerns that we might see? What are some things that you see?
Sure. Well, if we look at menopause, just to kind of give a little definition, we're talking about when we have the cessation of menstrual cycles related to aging. And we usually say that a woman is in menopause when it's been 12 months without her period. So if you look at the population in general, women without Down syndrome in industrialized countries, the normal age of menopause is between age 50 and 52. At least that's what it's usually reported as for white women. And then if you look at African American or Latino women, sometimes menopause is a little bit earlier, maybe 2 years earlier. So using the age of 50 as kind of like our benchmark for the average age of menopause for women without Down syndrome, I think is a pretty accurate number to start with. But when we look at our women with Down syndrome, we do find that they go through menopause at a younger age. So it's been reported that the average age of menopause for a woman with Down syndrome is probably between the ages of 44 and 46. So we do see that a little bit earlier than our women without Down syndrome. Now, as Dr. Chicoine was talking about, there's a lot of questions about this early aging that we see. So there is some speculation that the reason we see this earlier age of menopause in women with Down syndrome is because of that early aging phenomenon. But again, this is a big gap in research.
Yeah.
And part of being able to fill those gaps is identifying that first step is identifying that gap is there. So we do have a lot of questions still about why menopause is happening earlier, but we do see that it is happening earlier for our women with Down syndrome. When we look at, the symptoms of the symptoms of menopause, if you look at women without Down syndrome, some of the most common symptoms are hot flashes, trouble with sleep, vaginal dryness, changes in mood, even some bladder control issues. Now, we think that women with Down syndrome probably experience all of those same common symptoms, but a big difference is that it can be a lot harder for our women with Down syndrome to describe or express those symptoms. In our experience, hot flashes in particular, a very common symptom of menopause, can be really difficult for our women with Down syndrome to explain or express. And so it's oftentimes the family members or caregivers who can come in and tell us that they think that their loved one is experiencing hot flashes and related to menopause. Sometimes those hot flashes, family members catch on to that because they might see that the woman is experiencing like intermittent flushing. So all of a sudden her cheeks are turning red. Maybe she is, hot and trying to take off her sweater. Sometimes it's sweating, right? You can see that she's starting to just like sweat all of a sudden. But even trickier, sometimes it's just irritability. Like she'll just become irritable and just really acting out, and then everything passes. And it's just kind of this coming and going pattern. And So a lot of times family members or caregivers kind of catch on to that. And so they can bring it to the doctor's attention. And oftentimes it is, a symptom like a hot flash related to menopause. When we look at the treatments for these things, I'm not aware of any studies that are really evaluating the treatment of menopausal symptoms in women with Down syndrome. If you look at the literature for women without Down syndrome, there's even a little bit of controversy in that literature. There's a lot of questions about the roles of hormone replacement therapy and the risks and benefits associated with those treatments. And there are no studies that are specifically looking at hormone replacement therapy for women with Down syndrome. So again, another research gap that I think there's a lot of interesting questions there, but we just don't have that data yet. So at this point of time, we treat the signs and symptoms of menopause for our women with Down syndrome with a lot of the same tools and medicines that we use for women without Down syndrome. So sometimes we just are using, these benefit risk discussions to try and figure out what's going to be the best treatment option. But I think a lot of times we're able to find something that helps our women feel better.
Yeah. When you're talking about the hormone replacement, just for our listeners, you're talking about like estrogen replacement therapies. Is that what you mean?
Yes, that is what I mean. Estrogen replacement therapies.
Mm-hmm. And when you do that in, let's say, in the typical population, remind me, because again, you're speaking to a pediatrician. So the main concerns of using that type of therapy, would those same concerns be there in somebody with Down syndrome? Like, I'm not sure exactly. What are the concerns? Like, where does the controversy lie at this point for the typical population as well?
Yeah, so there was a big study that came out a couple of years ago looking at the risks of hormone replacement therapy for women without Down syndrome who are undergoing these treatments. And, estrogens, there's some controversy about their role in increasing risk of breast cancer, potentially their role with heart disease, and also some questions about like blood clots. So I think all of those things are big topics of conversation within the women's health community. And of course, those are relevant for our women with Down syndrome too. It's going to be an interesting question to figure out, if our women with Down syndrome have, perhaps lower rates of breast cancer, lower rates of atherosclerotic heart disease. What does that mean when we are looking at medications that maybe impact or increase those risks?
Yeah.
So I think there's a lot of unknowns, but those are some of the topics that kind of come up when you look at these things.
Yeah, that's what I was wondering as well. I guess for either of you, if you have somebody, a woman with Down syndrome who's experiencing significant symptoms with menopause, that maybe you would be considering something like an estrogen therapy or something like that, would there be hesitation because they have Down syndrome, or would you maybe try it just like you would in any other woman in your own practices?
I usually approach my women with Down syndrome as the same way that I would a woman without Down syndrome in my treatment regimen for menopausal symptoms. Okay. We have other medications that we can use and sometimes are, more first line or better options before we even get to hormone replacement therapy. So I look at that full gamut of options before I make my decision about what I'm going to be offering to my woman with Down syndrome. But ultimately, I end up using the same regimens for her that I would for a patient without Down syndrome.
Wonderful. Thanks. Brian, any thoughts from your perspective?
No, I would agree with that. I think that there in the past, there was this theoretical concern about increased blood clotting for women, or, like on birth control pills, women with Down syndrome on birth control pills or estrogen therapy. I think that that really the data is just not there to support that sense. And we've had a lengthy conversation with our hematologist here recently and decided that that's probably overblown. And if we don't go ahead and treat people just like Dr. Graham just mentioned, we're probably undertreating them unfairly. And so we do want to make them more comfortable with the available treatments.
That's great. Yeah. And I appreciate both of you highlighting that. I mean, I think that, while most of our listeners to this podcast are caregivers and family members, I think that we do have a fair number who are care providers. And I think it's important for them to hear that, similar to what we talk about a lot on this podcast, is we should keep in mind that the child or the adult before us has Down syndrome, but that shouldn't necessarily limit options if we feel that they may be safe and effective for that population as well, that we should give them a trial of it. So I appreciate your perspectives on that. Anything else on this grand topic of aging? I know there's so many things we could have gone into significant detail about, but anything that you all want to make sure that our listeners know before we get to the point of ending our podcast today?
I mean, I would just, I'm aging, or aged as the case may be at this point. I think
you said it, Dr. Chicoine, not me.
I was taught to tell the truth. I think that a key thing is aging and poor health are not synonymous, and we really want to encourage healthy activities, healthy diets, healthy sleep, appropriate screening, appropriate treatment of conditions. So all those things are important throughout the life of people with Down syndrome. And it doesn't end when they get older, and some of these things are not inevitable, and we do want to make sure there being both attempts to prevent them as well as address them.
It's fantastic.
Yeah. I would just add too that I see so many people with Down syndrome who, as they age, they continue to experience just a wonderful quality of life. And as they're aging, they're able to continue to engage in the activities that they enjoy and to, maintain meaningful relationships. And I just see that even as people are aging, they just continue to live great lives. And so we just want to continue to encourage that and empower that and tell people that that is happening. People are getting older and they're living great lives. And that's a great thing. And that's a victory, I think.
Definitely. I can tell you personally that when my brother and his friends were younger, they would get together and they would get the band together, right? And I was never allowed to be in the band because I didn't have the skill level to be in the band. But now as they get older, they're far more tolerant of me joining the band, which for better or worse, for music and as a whole, I'm allowed to be in the band now. So I agree. There is still fun to be had even as an adult, and perhaps some more acceptingness of their less talented siblings to be a part of their of their activity, which is wonderful. Well, but it would not be right for me to close this podcast without at least our listeners hearing a bit about what you have on in terms of resource materials through the center. Dr. Chicoine, do you mind just sharing with us, what are some things that families or caregivers might find on your website, and how would they access those?
Yeah, we've been very fortunate to have some support to develop an online resource library, and so that's available. I can read off the address, but it's easier just to Google
Sure.
Adult Down Syndrome Center, and you'll find pretty quickly find the Adult Down Syndrome Center resource library. So lots of information on there. We kind of broke it down into 3 categories: information for people with Down syndrome, for families, and then information for healthcare professionals. We've also recently, our mental wellness book, that our 2nd edition was published a few years back, and then unfortunately Woodbine House went out of business.
Mm-hmm.
So after looking at how it would be best to share that, we decided to make it available free online as a PDF. So that's available on our website as well. So please feel welcome to use that. So a lot of information on there. The only other thing I would add would be, particularly for families who are looking to help their healthcare professional get more information, we certainly have some on ours, but I would also encourage families to look at the Down Syndrome Medical Interest Group webpage. And if you're needing in an area where you don't have healthcare services for an adult and are needing some assistance, your healthcare provider can contact the Down Syndrome Medical Interest Group and participate in what's called Project ECHO, where they can anonymously present a case, your son or daughter potentially's case, anonymously. And then there's a panel of experts available on the call that will provide information to your provider. So that's a real nice resource that the DISMIG group is providing.
That's fantastic. Yeah, I will definitely include links to all of those things in the show notes. But there are a lot of resources out there that I think everyone should be aware of. And so I appreciate you putting that all together for us here just now. Well, I am so glad to have been able to record this podcast with both of you. I have learned a ton today, and I'm sure our listeners have as well. So thank you so much for joining us.
Thank you.
Thank you so much for having me.
Yes, yes. And to our listeners, if there are any other topics that you would like us to address, please do reach out to us at Down Syndrome Center at chp.edu. And we do read each and every one of those emails. Would be glad to find speakers that could join us like we did today. You couldn't find two more expert speakers on this topic, and I'm so glad to have been able to talk about this topic with both of you. And if you would like to join us in what we do here at the center, including this podcast, please go to givetochildrens.org/Down Syndrome Center, and we would love to partner with you in that way. But until next time, bye-bye.